Hello, everyone who's joining us. I am Teonna Woolford. I am a 30-year-old warrior and the co-founder and CEO of the Sickle Cell Reproductive Health Education Directive, or SCRED for short. And it is the first and only organization to solely focus on reproductive health and sickle cell. And so for a long time, we've had a lot of conversations around survival and organ damage and pain, but reproductive health hasn't really been included. So grateful to Agnes and the organizers of this for giving us this opportunity. And I have some amazing panelists with me, so I'm going to let them briefly introduce themselves. Just tell us your name, where you're from, and your genotype. Whoever wants to go first.
So I'll start. My name is Yemi. I'm based in the US, North Carolina specifically, and I am hemoglobin SS.
I'm Alexis. I'm from Queensland, Australia. I'm 29 and I have sickle cell beta thalassemia.
Oh, hi. My name is Sharif Tusuubira. I'm based in Lawrence, Kansas. I have sickle cell beta thalassemia. Yeah.
All right, sounds good. So what we basically just learned from Dr. Pecker's talk is that reproductive health touches all of us and it starts early. It's a lifespan thing. So with that in mind, I have some questions for you guys, and I'm trying to start from the beginning and we'll see how much we can cover. So first, I was curious to know if any of you had any experience with delayed puberty or what puberty was like for you, because I know for me, that's when I really started having a lot of pain crisis. So talk to me about what puberty was like living with sickle cell disease. Yemi.
If I remember, I started puberty maybe around 12. So I think that's pretty normal. That's a normal age. And I'll be honest, I don't have too many memories of what that was like. I don't think it was that difficult for me. I think it was just a normal situation. I had two older sisters as well, so they were able to kind of walk me through and let me know what to expect and what was going on. But I don't remember having too many pain crises surrounding my puberty, even though I had a stroke when I was 12, which may have been a little bit related. So I'm not really sure.
Okay. Sharif, well, just as a follow-up to that, do any of you remember having any conversations with your pediatrician about puberty and what that could look like for you?
Well, I think my discussion will probably be different because I was in Uganda at the time. So growing up in Uganda, we didn't really have that much focus on transition or talking about all that. But I think in school, we probably had a discussion on that. However, I was in a boarding school. So I think in a boarding school, I did not notice that I had a delayed puberty, because if you're in a boarding school, group of old boys, everyone is making fun of how they have the hair here and hair there and how you don't have any hair. So probably it's kind of, I did have to notice that I had some form of delayed puberty. But I mean, so I think my coping mechanism was to try and hide it from everyone, so no one has to notice, try and keep distant from everyone in time so they don't have to notice. So I did have delayed puberty, if I remember, and I guess I would add, I think it was very, very isolating, the fact that no one was there to come out and say this is what's going to happen, this is what's going to go on. So that probably was a big deal, was a big issue on my side.
I'm glad that you touched on that, because I think that we talk a lot about isolation in adulthood with sickle cell, but we don't really consider how it can start as early. And I had a similar experience. Alexis, what about you? What were your conversations about puberty? What do you remember about it?
Sorry, I'm pressing all the wrong buttons. My puberty was fairly normal as well. My parents probably had more of the conversation with me about what to expect and things like that. School was really good as well. They talk about puberty and what it's like and what to expect, and like sex education, and they start that like at that preteen kind of age. So I think I was fairly lucky. I had no issues with sickle cell side. I'm really lucky in the fact that I never had sickling crises at a younger age. I only started getting them in adulthood. So I think more so my thalassemia side with my hemoglobin was more affected once I had started like my period and things like that.
Mm-hmm. Okay, so we're all adults. So one of the things I like to talk about is like dating, relationships, and all of that. So I'm curious to know, because I see this conversation happening a lot on social media about warriors who don't know when to bring up that they have sickle cell trait on a date or in a relationship or sickle cell. And so I'm curious to know from you guys, what does that look like for you? What's dating been like with sickle cell?
I think I could start. So my thought is it's kind of very complicated because I think my whole journey into becoming a sickle cell, because becoming someone who's advocate for sickle cell, was to do with the dating relationship that I had. I was at college. There's this lady that I really like, and I had kept it quiet. Like no one knew I had sickle cell. Like I was dealing with it. Then all of a sudden I get to sick. I get hospital, and I'm away from school for like almost a month or 2 months, and everyone is asking, "Where's Sharif?" And then I couldn't hide it anymore. I had to say, you know what? Yes, I'm sick, and what's going on? I have sickle cell, and she was blunt, like, you know what? I can't. I don't see myself with you because of the sickle cell, and that to me was one of my lowest points in life, and that was my turning point to say, you know what? I think I need to be open about it, and let's become an advocate. And that was my turning point into sickle cell advocacy. But before, I was trying to live my normal life, try to hide and pretend and try to blend in as much as I could. So I think it's one of those hard things that we have to always go through. You have to either brave it on. I mean, I think everyone has their own challenge. But when I go to my other dating life now, it was what I was meant to start with, because I had gotten too attached to someone. Then it came in later, and they just said we can't do it anymore. So the next time I went to dating, the first thing I had to start with, like, no, I have sickle cell, and I do like you, and this like this. I think is one of the things I now have to start up have front with.
Alexis, what about you? What's dating been like with sickle cell?
Well, I probably didn't have much of a dating experience. I've been in a relationship for about, I think, almost 11 years. But I was always very open. All my friends and everyone around me knew that I had a condition and needed to go to hospital and things like that. And I've known my partner since we were 16. So he was aware of my condition and what that would look like and what my care looks like, and was really supportive of me, and is still very supportive of me when I need to go for treatment or when I become unwell and have sickling crises or whatever. And so we have a 3-year-old daughter, and I'm pregnant with our second child now.
Oh, congrats.
Oh, congratulations.
Thank you.
We're going to unpack that a little bit. Yemi, what about you?
Well, I believe I was always upfront with the men I dated. From the very beginning of the relationship, I would let them know I have sickle cell. And I had a couple of relationships where we were really close in the relationship, but I think further down the line, they kind of became a little bit fearful of my condition. And so ended the relationship because of my sickle cell. So that really affected me in a serious way, to an extent where I just said, okay, I'm just gonna try to find whoever accepts me and accepts my condition, even though maybe that may not have been the wisest decision for me at that time. But that was my coping mechanism, because I felt like I was being rejected because of my sickle cell. And I felt like there was a stigma on my life, or a stigma in our relationship, because I had sickle cell. And maybe that was just a reason, maybe not necessarily a true reason for the relationship to end. Maybe that was just a reason I was given, that, okay, well, because you have sickle cell, I'm not going to move forward in this relationship. But it really affected me. But I've always been upfront. I mean, this is part of who I am. Sickle cell doesn't define me. Sickle cell has never defined me. Sickle cell has just been a condition that I happen to be born with. And so I have no reason, or I felt no reason to hide it from anyone close to me. So, but yeah.
Wow, great answers. So Alexis and Yemi, I want to unpack pregnancy with you guys a little bit. Did either of you have any fear about being pregnant?
I was definitely terrified of being pregnant and what that would look like, and more so especially around birth, and how labor could trigger a sickling crisis or just any point in general. But I had really good support through the obstetricians and midwifery care team and hematology as well. And then also just tried to educate myself as much as possible about what I could do to prevent and just understand the different processes that were put in place to keep my pregnancy safe.
And so how did your first pregnancy go, and how is the second one going?
So my first pregnancy ended up being really straightforward. I didn't have a sickling crisis at all throughout pregnancy. It was really healthy. I was monitored very frequently, having, I think it was 4 weekly scans. I'm transfusion dependent, so I was having, at the beginning, 2 weekly blood transfusions, and then towards the end I was having apheresis exchange transfusions for the last few months. I was induced at 38 weeks with my daughter, and I was a bit unsure of the process, but went into it and it all went really smoothly. I was very lucky, and thankfully our daughter was healthy at birth and there was no complications. So extremely lucky with my first pregnancy. This pregnancy, I feel like my health is in a different position. My iron overload, I couldn't get it down as much as we would have liked, so it is a bit higher. I'm having regular transfusions still, so every 3 weeks. This time I've actually had a bit of sickling pain. It's been very moderate, been easy to manage with just paracetamol. But obviously I'm quite worried that I could end up having a really bad one further down the track, so I'm being monitored again. So I have confidence in the care team, and I'm always looking out for the signs and trying to keep as hydrated and healthy as possible whilst looking after a 3-year-old and working at the same time. So yeah, that's my experience so far.
Thank you for sharing. Yemi, what was your pregnancy like?
Well, my pregnancy started okay. I didn't find out I was pregnant until I was 4 months pregnant. So, and I've been taking hydroxyurea since 1994. So at the time I found out I was pregnant, I had to stop taking hydroxyurea. And probably about 3 or 4 months later, I had a really, really bad crisis. Well, before that, I was being monitored by my doctors as well. I wasn't on transfusions, which probably would have helped me and helped to prevent the crisis that I ended up having. But as I was being monitored, my counts were going up. My hemoglobin was higher than it had ever been, which surprised me because I had the assumption that it would be lower just because I'm growing a baby in my body. And so, but I was very healthy up until I had the crisis, and it was a pretty serious crisis. And then towards the end of the crisis, I developed preeclampsia, which turned into eclampsia. So my daughter had to be delivered 2 months early. And a couple of months, I kind of dealt with health issues, maybe up until January. I had my daughter in September. So it was very hard on my body. I believe it's because I stopped hydroxyurea. I'm sure it's because I stopped hydroxyurea because, of course, hydroxyurea helps to maintain my health and with the sickle cell. And once I stopped taking that, my body, my system was really, really very affected. But I mean, I got better. My daughter, she just turned 4 last week, so she's really healthy. So yeah, but the pregnancy up until my crisis was smooth sailing. I didn't have any issues. The doctors were surprised. I was surprised. I was never scared to be pregnant. It's something I've wanted since I was in my 20s. And the doctors have pretty much told me I'm not able to conceive, just for different medical reasons. And so I started believing that. And then I conceived right around that same time. So I was never fearful of it. It's something that I've wanted forever. And it's something I really embraced. And so I'm blessed with a daughter. And I'm grateful to God every day because it's something I didn't think would happen.
Right. And Sharif, I'm coming to you in a second, I promise. But Yemi, you and I have had a lot of conversations kind of about your journey, my journey. So I was wondering, what advice would you give to women with sickle cell who have been told that they can't conceive, and kind of how they process that?
100%. I would just have to say, you just have to believe in something outside of what the doctors tell you. All of us on this line, we're prime examples of that. We are born with sickle cell, and there's so much that's said surrounding our health status and our health, just having sickle cell alone. So, we're told we can't do this. We should, limit activities, live life in one strict type of pattern. And I believe all of us are prime examples that, okay, well, yes, that's true. But then there's another side of that truth. And I choose to live in my truth. So the doctors can tell you pretty much anything. I've shared this with you before. My oldest sister was born with sickle cell, and the doctors told my mother she's not going to make it past 18. And she lived until she was 45. So the doctors can tell you what they know. When the doctor told me I wasn't going to be able to conceive, I started to believe that. But then I knew that there's something so deep in me that has desired a child for forever. And I had my daughter when I was 42. So it took a long time for me to even have her. But I kept seeing my daughter, and I kept seeing my child. And it's a desire that was given to me. And so I think for us, just hold on to your hope, hold on to your desire, and don't let anyone tell you what your truth is. You stand in your truth, you decree your truth, you declare your truth, and then you see things open up for you as a result of that. And they open up in different ways. So there's some people who don't have sickle cell and can't have children, but it's just, you just have to stand in what you believe, and don't let anybody convince you otherwise.
Thank you. That was beautiful. So Sharif, a lot of times I think that when we talk about reproductive health, we hear a lot about kind of women and girls, but I wanted to hear from you kind of about what reproductive health means to you as a male warrior. Like, what has your experience been with priapism? I know that's incredibly personal, but
no, it's okay. I think one of the key things to me, one, it's priapism is one of those very difficult things that it's always hard to probably open up to people. Because to share my first experience, I had priapism. My first priapism experience was in 2017. I was in DC. I had a big conference. I was trying to give a big talk. I think it's the day after my big talk in DC. So I woke up in the hotel room. I had priapism. I just couldn't do anything. I called 911. They had a fire truck, an ambulance come. They picked me up from the hotel. They took me to Howard University Hospital, and I ended up in the ICU. So when I ended up in ICU, so my wife was like, "What's going on? How you find? Are you okay?" Because she told me every time I would get sick, I would openly tell her, my hand is hurting, my leg is hurting. But this time around, I didn't say anything. I was just saying I'm sick. So she was like, "What's going on? You're saying you're sick. What's really happening?" It took me a while before I could actually open up that I was expressing priapism. And then from that moment on, it went on to become a very chronic issue. So then it's probably been very challenging to me in terms of, I think, like Dr. Peck had said earlier on, having to wake up in the night 2:30, having to cope with the frequent ER visits. There was a time sometime last year, I think in the middle of the pandemic, I actually had to go to ER almost every week. So to that extent, I was feeling very uncomfortable going to ER every week, because given my being a Black man in the US, frequenting the ER almost every week, so there was a lot of issues. A lot of issues happen at the ER. Doctors were actually thinking I'm actually trying to either fake my crisis, or this is actually not going on. But the truth was, I would wake up in pain every night. I'd wake up in pain every night, and there's nothing else I could do apart from either run to the ER. I think the last thing I had to do was talk to my urologist. You know what? I should be able to do this thing at home. So right now, because of the fact that I have chronic priapism, I had given all these phenylalanine and all those things, so I can be able to self-inject from home without having to go to the ER. So just how to show you the extreme that I have to go through in terms of saying, you know what, to avoid all the ER issues, to avoid all the racial issues that may happen to me in the hospital, probably the best thing for me is to try and self-inject myself from home, because this is a chronic issue that I have to deal with. So that's, to me, it's probably been pretty hard on that side in terms of the priapism. But another thing also that happens, I think, being a dad and being a father, when you do take hydroxyurea, these are some of the things that you always have to talk about. You know what, sperm counts, and if you want to have more kids, what are you going to do? So it's always a conversation that always keeps on coming to my mind. But to me, I think the priapism has been the biggest challenge. One, because it's hard to open up about, and also the healthcare, often it's one of those things that people do not really understand that much. When you go to the ER, for example, what's going on, this is what's happening, you have to wait in the room for some time. So really, it's a big, it's one of those personal issues that make sickle cell really challenging. The fact that you have to share a very intimate part of yourself with so many other folks to see what's going on. And the fact that the experience that I had, especially when I used to go to the ER, different hospitals, one doctor will come and tell you, and they don't believe, they have to go call another guy. 4 people or 5, 6 doctors have to first come and check you, just to be able to believe if what you're actually saying is true, if this is actually a real episode, or you're faking it, or you're just here for the opioid or for the medicine. So that was also another challenge in its own self. But I think it was pretty hard. It's still one of those hard things that I still have to cope with and deal with on a day-to-day basis.
Mm-hmm. And what would be like a word of advice that you would give to a young boy who's dealing with priapism, like about the emotional toll? What's your advice to him?
I think one, acceptance, I think, is one of those things you always have to deal with. Because the fact that I didn't have priapism in my life until I got like 26, or no, probably like 25 when I got priapism. I never experienced it in my whole life before. So sadly, I think on a benefit, I think on a good side, the first time I had priapism, I was in the US. I wasn't in Uganda. So I was in the US. I was able to go to a hospital. They took me to the ICU. I was in the ICU for like 5 or 7 days just because of priapism. However, I do feel, I don't know, this is my own perception and feeling, that the urologist who worked on me probably at the time may not have done such a good job. So the chronic issues happened because of what they did, because I stayed up with a lump in my penis. I think the lump was a result of the first irrigation that we're doing. So that may have caused me to get the chronic priapism that I still get. But no, it's just a thought that I have. I mean, it's not it's a hypothesis I always have in my mind. I've never proved that. But maybe it's a blame game. I don't think I'm blaming the urologists for what they did. But I just think acceptance is one of those things that probably have to deal with. And also the other thing, I think when it becomes chronic, in my case, I think the other option is to talk to your care team. See how best can you find other coping mechanisms without having to take you to hospital, because going to hospital in itself is a big toll. Like an example, I'm a grad student. So every day I would have to go to the ER. I would have to lose one whole day of school, because you wake up at 4, you're in pain, get the ER maybe 3 a.m., 2 a.m., be in the ER up to about 10 a.m. or noon or 1 p.m. So I've lost the whole school day. If I was working, this is what you'd probably see. If you can't keep on losing work days at work, you can't show up because you have to go to ER. So I think these are things you have to talk to your care team and see how best you find a coping in terms of the having a support system. I think is one, address the emotional stress, but also having a good management plan to help you be able to navigate and survive through the whole the whole experience you're having. I think that's
Great. So one of the things I was worried about, because reproductive health and sickle cell, there's so much to unpack. So I was worried about us staying under the time, but we did great. We're right on time. And Agnes has just posted the next session, the link for the next session. But before we head that way, I just wanted to thank you guys, because I know that there is a stigma attached to reproductive health. So I thank you guys for being so incredibly transparent. And I think that we got a lot of insight, and we're getting comments about how brave you were and how grateful people are for your stories. So thank you again. This was amazing. I think we could stay on all night talking about this, but that was great. So I will see you guys in the next session.